it is not only my cognition or my individual reasoning, but it is a combination of my reasoning plus the algorithmic products that have been put forward to me by AI.
Hello and welcome to the Test Community.Network. My name is Tim Burnett. I hope you're safe and well. This week we've got an interview with Ebrahim Talaee. He's based in the University of Arizona School of Medicine or College of Medicine. He was based up in Toronto and he's now moved down to the university there, and he's been in post for about 6 months, and he's tackling some kind of the early projects for them around the use of adoption of AI for creating items as part of their item authoring process. But he's also looking at the kind of wider implications, particularly in terms of things like performance-based testing, but also just the cognitive process and the mapping between what medical people have been doing in the work practice and how that can be assessed within the assessment space as well. So this is a really good conversation. He is a fellow ambassador with myself for the IAEA conference that's taking place in Toronto in October. So that's end of September to October. Now, I'm going to put the show notes, a link to the show notes, but we're getting close to the early bird sign off. So if you really want to go and you want that cheaper discount, then make sure you get yourself signed up for him. So I'm going to play that in a second. I just want to show you something that I've been working on. As you know, I like to dabble. And this is a new recording little app. So in the context of sometimes you just want to record or share a recording with other people without any kind of major hassle. Maybe you're working for an association, you want a bit of social media promo gathering, then you can share this app out. You can use microphone, you can screen, you can test the mic, you can put show notes in, then when you enter the stage, you can record, and you can also take a screenshot. And not only does you do the recording, but it gives you access to download the MP3, the MP4, so it's a video file, the WAV file, the transcript as well, so you can whack that into a chat bot and help you generate your social media content for you. So to go to capture.testcommunity.network for more information about that. And again, I'll put that link in the show notes. So on to my interview now with Ebrahim, and it was a fascinating conversation, really, really interesting, and I hope you enjoy it. Over to Ebrahim. Welcome. Are you well?
Thank you. Yeah, great.
Excellent. Well, thank you for joining me. And for people that have not met you before, do you want to introduce yourself, tell a bit more about where you work, what you do, a bit of your backstory?
Sure. My name is Ebrahim Talaee, and at the moment I am associate professor at the Department of Biomedical Informatics and also the assistant dean of College of Medicine at University of Arizona here in Phoenix. My background is mainly in education, curriculum assessment and evaluation, and I did that all in the UK at University of Oxford Department of Education. And my focus has been, since graduation, on how we can enhance the learning process through improving the assessment and content side of the education, which is the curriculum.
Excellent. Now, we're both working together as ambassadors on the IAEA conference that's coming up later on this year in September in Toronto. And I'm taking this opportunity to meet ambassadors like yourself and learn a bit more about the work that you're doing. And now I understand you've been in post about 6 months now, haven't you? And you're doing some exciting work around the area of item development and performance testing with potentially a bit of AI. Do you want to tell us about the item development side of things first, then we'll have a look at the performance stuff?
Yes, in medical education, there are two main phases. The first phase is the foundation phase, the first 2 years of medical education. And then the second 2 years, which is the clerkship period, when the students spend most of their time in the hospitals and clinics. For the first phase of it, we have a lot of traditional multiple choice questions and exams. So for that piece of the assessment cycle, we use different types of technology, including AI, from item development to the administration, and then the psychometric analysis that we do on the results, and then the enhancement or the improvement stage of the cycle, which happens both on the questions for the Q bank that we have, and also on the curriculum or different, let's say, part of the curriculum. So for the item creation, so far our faculty has been trained to create questions based on a guideline. It is a national guideline which comes from NBME, National Board of Medical Educators, how to create effective multiple choice questions. Usually in medical education, it starts with a scenario, talking about, for example, a 60-year-old man referred to emergency with hypertension or a headache. And then after that scenario, we've got a leading questions that the students should either answer the cause or the physiology behind it, or sometimes a treatment plan or something. And then we've got 4 or 5 multiple the options. So that is how medical education usually define a multiple choice question. It is much longer than the traditional form of multiple choice question that we know. So AI has been really instrumental in creating those cases or in cloning some of the items that we have already had in our Q bank. So AI has been used to change the setting from an emergency to an inpatient section, or change some of the vitals, or change the patient from different culture or different ages or different gender. So that's how AI has been already used in our college. And then now we are working more toward how we can use AI to generate new questions based on the curriculum, the content that we have. We are revising, constantly, and based on the template and also the guideline that we have so far. So we are working on the type of prompts which can lead into more ready questions or the output at the end.
Yeah, I think there's a true art, isn't there, to the prompting process. And I suppose prompting is a new skill in a way, isn't it? I know it's kind of 4 years old, or 4 or 5 years old, but are you finding that your subject matter experts are adapting well to that? Do you think they need more guidance in the prompting to get more out of the output? What's your kind of thoughts on the prompt approach?
Yeah, for that section, that content experts are content experts. We don't expect them to be prompt engineers. So we have started to work on the type of prompts that has worked well so far. So coming with a template of a prompt that what should be included in the prompt and what shouldn't be included. So we have now come up with a couple of those prompts which have been proved to be useful for the content experts, because in medical education, what we are interested in is not the answer that the students give to a question, but the process of getting to the answer is really important, or what we call it reasoning, or professional judgment of a doctor to get to a diagnosis. So we are interested to see how they get to the answer. Therefore, the way question is formatted is really important, so that the way that prompt should be formatted to get to a type of question that make the reasoning process more visible for us is also important. So that's why prompt engineering, as I said, we have tried to make it more template based rather than asking or requesting or expecting content experts to know everything about prompts.
Yeah, and you're using Microsoft Copilot, is that correct?
Yes,
for this process.
Yeah.
And do you have any kind of plans to use agentic tools with it? So the Copilot agents, for instance, as part of that process?
Yeah, that's part of our plan at the moment, but we haven't started exploring that because I joined the college only a couple of months ago. Yes, so we are toward that agentic form of Copilot as well.
Excellent. Well, I look forward to chatting with you more about that one. I'm delivering a session at the conference about my experiences with item generation and AI. But you're also looking at the performance side of things in a bit more detail, because I imagine many doctors and healthcare professionals are going to be, their skills are going to be augmented, aren't they? Their role is going to be augmented by AI in an increasing amount. And I suppose it's naive to think that we can continue to assess them without AI being part of that process. How are you looking at that as the journey? How do you assess, or what's your plan around assessing where AI is going to be part of the kind of traditional work and role going forward?
Yes, that's a very great question. That is the second section or the phase of medical education, which is the clerkship, and the students spend their time in the hospitals and clinics. All the assessment in that phase is performance-based assessments, or what we call WBA, or workplace-based assessments. These assessments are traditionally subject to a lot of subjectivity, because the students are being observed by different preceptors at different time of the day, at different season and weeks. So we've got that performance-based assessment can be inherently subjective as well. But anyway, coming from that side, we are trying to see, how AI can enhance the credibility of WBA's or workplace-based assessments. We started with what we call job analysis. So how does a doctor at the moment, at this time, start his day or her day from morning to the evening? So we look at clinics and hospitals. When a doctor gets to the hospital, the patients that the doctor is going to visit has been already triaged by AI. So the high risks one are on the top. So as I said, the beginning of the morning of the work starts with something, let's say an AI product. Then it goes to the next stage. The AI again summarizes the history of the patient, the family history, the social history, and everything for the doctor. And then the physical examinations that have been already done on the patient, again, has been summarized by AI. So as you see, AI the doctors live in an AI saturated environment, and let's say an ambient environment of AI for them. Therefore, we need to train doctors for that type of practice. We need to see how medical education can help doctors use AI in a way which is more reliable. So that's why some of the scholars have referred to this type of cognition or knowledge that people have, including doctors, as a distributed cognition. It is not only my cognition or my individual reasoning, but it is a combination of my reasoning plus the algorithmic products that have been put forward to me by AI. That is the triage that has been already done for me, or my day has been planned based on AI. So AI analysis and output. So a doctor should be able to use or let's say check the credibility of those outputs. So that is how we are looking at that. Some scholars again call this competence epistemic judgment. And that means the doctors should be able to check the credibility of the knowledge that they get, and do not rely only on the algorithmic outputs that they receive from AI, because we all live in an algorithmic saturated environment from the morning to the evening. So we shouldn't be treated like a person that is users of those algorithmic, but being able to professionally judge those outputs.
And there's a great risk, isn't there? Because if we all develop the skill where we're offloading our thinking to these tools and increasingly being reliant on them, and I think I always use the analogy of the driverless car. We're all moving towards this idea of a completely autonomous driving car. But if we're not in control of our ability to question and analyze the outputs and use them sensibly, and we just go with them, there is a huge risk, isn't there? I've just finished reading the book called AI Snake Oil, and in there they cite a number of medical-based examples where systems were introduced which were then scaled and put in other institutions where the data, because the data was wrong at the very start or very narrow, they weren't working as well, and medical professionals were relying on them too much. I suppose as part of your process, your teaching and learning process, is to make sure that people are very, very thoughtful about how much they rely on these tools, isn't it? It's a very important part of the process.
Yes, I mean, as an education institution, we need to be careful of the type of competencies that we really want doctors to have. And one of those key competencies is being able to professionally judge over AI outputs. You gave a very good example. Here in Arizona, we see a lot of these Waymos, but a very good example that I have read somewhere, I can't remember where I read it. These Waymo, if you change the stop sign by putting some dirt on it, when a human reaches to that stop sign, they look at stop sign and they realize that this has been distorted by a human, by a child, so they stop
Yeah.
there. But when a Waymo reaches that point, they see it as a non-stop sign, so they just continue moving ahead. So
Yeah.
that human side of it is everywhere. Your example now for a medical doctor, which is working in a high risk situation, that is much more important to realize that this professional judgment or this let's say cognitive ability that they should have over AI to override, to evaluate the output is really critical and crucial.
Yeah, and there's a term I know we talk about human in the loop a lot. I talk about expert in the loop is my kind of frame, because I think human is that's just a, my child in the cockpit of a plane is a human in the loop, but that he's not exercising judgment, he doesn't have authority, he doesn't have the knowledge and skills to go with that, whereas you need an expert in that position. I think it's really exciting stuff. So in terms of the conference in IAEA up in Toronto, we're all excited. What is it that you're excited the most about the conference?
Yes, based on the theme of the conference, which is transparency and technology, I really would like to talk to some like-minded people to see how they are working in the realm of assessment in med ed, because I know that in previous conferences, especially I think 2 years ago when it was held in Philadelphia, we had a few people from med ed and assessment. So I hope that now, which is not far from US, I hope that many or some medical colleges and schools of medicine from Canada or from other parts of the world also attend. So I want to really listen to those presentations, get engaged with them to see what type of experience they have had in both the preclinical and the clinical phase of med ed. So that's one thing, and the other one is the general trend of assessment, or how assessment is moving forward in the world of AI, to see how this cognitive ability that we as humans really need to develop. I'm interested to see how other people are struggling with this and what type of solutions or responses they have for those challenges and struggles.
Excellent. And are you presenting yourself at all? Or are you just
Yes.
participating?
Yes, I'm presenting a paper on, again, clerkship grading. As I said, clerkship assessment is really important in our medical education arena. Therefore, I'm presenting a paper on how workplace-based assessment or performance-based assessment in the clerkship phase can be more valid, and then after that, the grades that the students receive, because the grades usually are a point of, let's say, controversy among the students, whether this is my grade or should we, because grading is part of the assessment as well. And some schools go for example, letter grades. Some schools go for 2-tier grades, pass, fail. Some schools go for 4, fail, pass, high pass, and honor. What type of message are we getting across by using different types of grading scheme?
Yeah, and I am sorry. That's going to be a really interesting session, and what I'm looking forward to most is because we've got a good few days in Toronto. Normally with these conferences, you're there for 24 hours, and it's a very kind of fly in, fly out. You don't really get an opportunity to have these in-depth conversations, and these areas are the ones that I really want to have this conversation. I want to learn more about your experiences with this. So I'm really excited about hearing that. I wanted to mention just as well, you might find this interesting. So there's a lady from MBME who gave a presentation at the Assessment Horizons conference I went to in Cambridge, organised by Cambridge University Press and whatever their name is now. Sorry, Cambridge, I forgot. Anesthesia. I'll put a link in the link, but she gave Anesthesia gave a fantastic presentation about feedback. She's done a lot of research about feedback, about timeliness of feedback, and the value that it brings. So I'll add that into the show notes for this. But I'm really excited about your session as well. And You've been to Toronto, haven't you? You've lived in Toronto for a bit.
Yes,
right?
Yes, I lived and worked in Toronto. Yes.
How much of a fantastic city is Toronto?
Oh, that is great. I really, really suggest it to everyone who is both interested in the topic of assessment and also interested to see a very cosmopolitan city, and at the same time a city of nature. Especially in September, the nature is magnificent, and Niagara Falls, which is I think part of the program, should be part of the program for the
I think it is. No, I think it is. Yeah. So I'm really excited about it. My family is very jealous that I'm going, but that's brilliant. Well, thank you for your time today. I've really enjoyed this conversation. I look forward to obviously catching up with you in Toronto and having further conversations and seeing your presentation. So thank you for your time, and good luck. And if anyone wants to join us, reach out to myself or Abraham, and I'm sure we'll give you a guided advice as to how you can get on board for the IAEA conference. Thank you very much, and we'll speak soon.
Thank you, Tim. Okay. Have a great day.
Bye-bye. Thanks, Tim. So that was great. Really interesting conversation. I'm quite excited to see some of his research work in his presentation at the conference as well. And I've got more interviews lined up with other ambassadors from the IAEA. I've got next week, all being well, from Pakistan, just learning about the education system out there. So some fantastic conversations to come. I'm really looking forward to the conference. And I've put in Anesthesia's LinkedIn in the show notes, so you'll be able to see that there. You'll see she's written a book about feedback as well. So I'm hoping to get her on a guest on the show very soon. And I've also put in the link for the Capture app as well. I've been working on something else as well. Lots of stuff. I keep creating apps. Anyway, you take care, and thanks for all the great feedback as well from the webinar from last week about vibe coding as well. I really appreciate that. There's lots of people reaching out to me on that one. Take care, and I'll speak to you soon. Bye-bye.